Preview.
Hey, I'm Dr. Joe from Full Function Rehab. So I want to start off today's story just talking about hand numbness. How many times do any one of you wake up with hand numbness? You wake up, hands are cramped, hands are sore, and you're just feeling like you need to shake it out in order to experience some relief and just to wake up the hands. Very common. It's not always what you think it is, and usually you would think it's carpal tunnel nerve syndrome, where the nerves are impinged and you're getting hand cramps, things like that. Could be the case, but not always the case. So it could be very uncomfortable, doesn't feel nice. You pick up an object, you reach for your glasses, reach for your cell phone, and your hands just feel awkward. This is normal. A lot of people come in experiencing these symptoms, and we try and do the best we can to relieve the problem. So some things to consider is your sleeping position. So if your hands are underneath your pillow or they're in an extended position for a long period of time, that could put pressure on different areas of the nerve, different areas of the shoulder, which is leading to more problems and more pain down into the hand, into the arms. So a sleeping position is one thing. Your pillow is another thing. So we're going to talk about pillows on another segment here on our IG stories, but your pillow can be a contributing factor to some hand numbness and arm weakness just based on the position of your neck and compression on certain areas. But one thing that I really want to talk about is actually the rotator cuff muscle. So there's 4 of them in the back of the shoulder. Well, there's 3 in the back of the shoulder, 1 kind of on the inside of the shoulder. But a lot of the times when we're experiencing some numbness into our hands, sometimes it could be what's called like a trigger point referral. So what a trigger point is, it's a knot in the back of our rotator cuff, and it's very, very tender to the touch. And when we're lying on, so if we're lying on our side and your side is being compressed from the mattress or the pillow or something, it's putting some extra pressure onto those knots. And when those knots get irritated and they develop a referral pattern, it's called a trigger point. So if your full hand is numb, most likely the rotator cuff trigger point is what's causing the problem. And compression on there all night is releasing some of those sensations into the hand. So not the biggest problem to deal with, very easy to fix. It's a matter of stretching the rotator cuff, putting on some heat in the area, getting some soft tissue work just to kind of release the pressure in those regions, as long as we're not dealing with an actual nerve pinch. And how do we know this? It's all based on the presentation of your hand. So certain nerves go to certain fingers. So if it's these 3 fingers, okay, that are affected, usually we would say it's carpal tunnel, okay, because the carpal tunnel nerve, which is also called the median nerve, attaches to these 3 areas, and these 3 fingers get affected. If it's these 2 fingers, okay, these 2 right here, 4th and 5th, it's called the ulnar nerve. So if anybody's hit their elbow and they hit their funny bone and they get that numbness kind of shooting down into their hand, that's that ulnar nerve, and it usually affects these 2. So if it's these 2 only or these 3 only, that's one or the other nerve. Sometimes people are coming to my office and they're complaining of a whole hand being numb or the back of the hand being numb. If that presentation is everything, then it may be all the nerves that are compressed, we don't know, but most likely what I found in my practice, it's dealing with some rotator cuff trigger point referral, which can lead to pain coming into the shoulder, goes down into the elbow, sometimes numbness into the whole hand, things like that. So if you wake up in the morning and your hands are crampy, your hands are numb, and you feel like you gotta shake it out, definitely try doing that, but try doing a little bit of self-massage onto the shoulder, go take a nice hot shower to release the pressure in your rotator cuff, and you may be pleasantly surprised that would help a lot more to reduce your symptoms. Thanks.